Today we're starting off with a podcast about something I near and dear to me because my son's autistic, but and I should have said this a long time ago, and I have been saying it, but clearly, but autism is a movement disorder. It's one of the reasons we really are missing the ball on true autism or what autism has become. It used to be a genetic disorder. Charge, Prader-Willi, Fragile X are just to name a few, right? But with the increasing number of autism, right, we've gone from like 1 in 3,000 to now 1 in 27, I think, in some states. You can't have a mutation, let's say, that fast if it was strictly based off of genetics. And as a movement specialist and a gravitational specialist as well, I'm just here to say that we're really missing the point of autism being a movement disorder, right? And by understanding where movement also gets affected in your child and or yourself, you're learning what to work on, what to work with, what to change possibly in your system. And it but it's not a label, it's not a sentence. We're going to explain how a child can get into trouble just movement based, and what happens to the body when it loses which is my specialty, the ability to rotate, to organize vision, and respond to gravity. We take it for granted, but we have gravity from the day we're born to the day we die. But when you have a movement disorder, gravity is a lot harder on the system, right? That do not fall or trying to get up, all those connotations, all based off of that gravity is just not our friend when we have a movement disorder. And autism has very specific movements around this phenomenon that we work with.
This changes everything because it means we stop chasing behavior and we start restoring function. The experiences we discuss on this show are for educational purposes only. Please do not substitute them for professional medical advice, diagnosis, or treatment. And if you notice any pauses during this episode, we ask you to keep listening. Sometimes, someone's processing their thoughts or it's part of the natural flow of conversation.
Hi, I'm Michelle Turner. I am creator of Movement Lesson. I am here to discuss a topic, again, that's close to home. Autism is a movement disorder. The whole reason I've come to be is because of my son. My son was fine until 13 months, and he got sick with Haemophilus influenza. We didn't know this for 3 years. So again, that was my plight. Why was my son walking, talking, using utensils at 13 months, and then he couldn't even roll over? Um, I wasn't told this was life-changing. I wasn't told that I now had a new career as a mom as well as a professional. None of that came to being. I just thought my son was sick for a week, he'd be fine. So full on, again, when you're losing skills, especially on a young child, I maybe would have had a different approach had this happened, let's say, at birth, right? Which Kay has the experience with, but and many others do. But having watching someone go through a movement disorder, I don't care whether you're 60 years old watching it happen to a spouse or a family member or a colleague versus again a child. I don't see how it's any different. But it just it is what it is. But my son was diagnosed. The first big diagnosis he got was the autism because again he was nonverbal and they said he would never walk or talk. But I kept saying, guys, he's autistic, but he's sick. So I was dealing with the movement disorder from a very chronically ill child. I mean, my son has no immune system to bacteria. He's had 30 surgeries. So again, his movement disorder is based off of trauma and events, not necessarily of because again, genetics or a neurological issue. Now, some people might say he was predisposed to all of that. But long story short, this is how even Kay and I have come together, and we're doing this great podcast called Rock the World. And I'd like to introduce Kay.
I'm Kayla Ireland. I have cerebral palsy because of my traumatic birth. Although this is my primary diagnosis, it involves movement disorders that affect how I navigate the world, needing equipment and 24/7 care. Despite these challenges, I refuse to let any obstacle define me. I am a powerful force that advocates for inclusion, representation, and the boundless potential within every individual through podcasts and other advocacy work. For instance, I have dysphagia, a swallowing disorder that increases my risk of choking. While some with this disorder can self-feed, it's not realistic for me. I need a cup with a lid, straw, and handle to hold it securely. The size and thickness of the straw and liquid affect safe and efficient drinking. Smaller straws control the bolus size and reduce aspiration risk. Thickened liquids improve swallowing control. Smaller straws reduce liquid intake, making it easier to control the flow and swallow safely. Larger straws may overwhelm the swallowing mechanism and increase aspiration risk. Thickened liquids slow liquid entry, giving swallowing more time and reducing aspiration risk. Thin liquids flow quickly, increasing aspiration risk. I don't walk independently because it's not the most efficient way to move. However, I did physically walk across the stage at my graduation ceremony with the assistance of my paraprofessional. I also transfer myself from my bed to my wheelchair and then to the couch without any assistance. In fact, I'm quite capable of riding a horse independently while off lead, riding a quad, and even roller coasters. Additionally, I can ride shotgun in a car despite being in a special needs car seat when I was younger.
Okay, if we ever meet up, we're going in a roller coaster. I like roller coasters. Yeah. Um, so with the movement disorder, we have to look at what we see and what's really happening. So when a child doesn't make eye contact, we label it as behavioral. But what if it's not behavioral? What if the eyes aren't working properly? They can't converge because assistance, the system or the body has no access to organize through gravity. And and you might say, "Oh, my child's walking. I don't have this issue." Well, you can tell gravity's off with the stim or the vision because again, this kind of thing. I'm not looking at you. I'm not responding to you. But this is sort of like with autism. This is like they're saying, where am I? You know what I mean? Like right now, I know I'm in Arizona. I know I'm in Maricopa County. I know I'm in North America. I know I'm in the America. I don't think that way. I don't think that. Oh, good. I'm on planet Earth today. Let me go. But our
Mm.
systems have that navigation within them. That's why when we say, "Hey, go to the store," we should know how to navigate, and it's taught through. But for my young baby, they should be able to be held and put down to the crib or back again. But that the startle and the like, I like to say, even with cerebral palsy, kids aren't born with dystonia. It that happens because of the ill relationship to gravity when the spasticity really comes, the ataxias. But with autism, even though it's not as available to see, you have to look to see where the breakdown is within the body.
Anti walking. That's not a quirk, that's a rotational failure in the pelvis. The child doesn't have the system to yield downward through gravity.
Right. And like even meltdowns or people like self-harm. It's very common for autistic kids to self-harm. No, it's not. Usually they have a headache and they want to get it out. They're not shutdowns, they're tantrums, but when gravity just floods the body and they can't manage the input and they don't know where their midline is or how to stabilize breath, vision, and posture. These are all things that we don't work on. We do because we can. And these are things that need to be looked at for autism as a movement disorder.
This isn't theory. We see it every day. And once you understand how the body organizes, or doesn't, you will help yourself, the child or adult.
Right. So I've been putting in a ton of science behind this to prove how there's breakdown in the human body and that breakdown is what we look at as a movement disorder. So I've been saying this for years. You can go back and watch hours of videos with me. Um, Gravity is not a force acting on us. Our bodies, our systems need to learn how to respond to it. Like if I'm tilting this way, I'm not worried about gravity pulling me to the floor. It's not pulling my hair out, right? But if Kay might go off to the side, all of a sudden gravity's pulling her to the floor. It's a completely different organization or phenomenon that starts to happen. And I don't mean to pick on Kay, but people don't realize that even a baby putting them down, even though they're on the table or on the bed, they're not lying, right? Um, Kay unfortunately will never know what it's like to just lie down. And in the way that you and I experience it, she might be on the bed, but she's not lying down in that sense. So sleep can be very difficult, which adds also to the autistic tendency or the movement.
I'm in a constant tug of war with my own body.
Yeah, yeah. And tug is the ultimate answer. It's because you're being tugged, in a sense. I'm not being tugged. I never have to worry about that. And it's a different phenomenon within the brain. And so when the system breaks down and getting back to autism, right? The body's learning how to adjust, but babies don't just roll over, they rotate through it. They breathe, they have vision, inner torque at the same time. We're finding midline, and that's how we start building functional movement. And by the way, functional movement is something you could do something to, in a sense, save your life. So feeding, rotation, fixing my hair is rotation. If I'm getting dressed is rotation. And that's where too it can be frustrating as a caregiver that you're working with someone because you're expecting someone to try harder to put on their shirt versus
Yeah.
ver- versus again, it really is just rotation. That's when you're not, you can't rotate. You're not building up those mechanics, and that's where again the frustration. So that's why we're here to talk about the movement disorder behind it.
And when those foundational movements don't happen, when the baby doesn't grab their feet, doesn't come to midline, doesn't rotate into sitting, that's not a delay. That's a breakdown in system organization.
Right. Dr. Oz wrote a great book about the human body, and they said it asked in there, should you floss? And it said, no, only floss the teeth you don't want to lose. Um, Development is development. Milestones are milestones. There's many milestones, but besides the top 12, but you can't the system's not meant to miss opportunities of movement. And missed opportunities of movement, again, you think the child's still walking, they get lost. And then also too, this is why parents get lost with professionals. They're looking at specific goals without understand their development leads, right? And so it often fails. It's just like when you're trying to put a second story on a house, the foundation was built for one level. So you either have to really support that foundation or you can't build a second story, right? Well, it's called reinforcement. But on top of it, neurologically and physically, when a child doesn't have that gravity-based organization, the brain doesn't know where here is.
Is there a difference between development and milestones?
Well, so to look at development, I look at more at the qualities of movement, weight transfer, transitional skills, rotation, midline. I'm doing a whole big course right now, midline, right? There's midline within my body, but again, if I'm here, I still have midline. It's not just about the sternum. So as I develop, first of all, I'll find my midline, but then I'll cross my midline, and then I have rotational midlines. These come, that's development, right? But milestones are looked at like every 4 weeks. We should have a big achievement. Tummy time to looking at you, grabbing your feet. Now, autism, I can almost guarantee you we had a problem grabbing the feet. We had a problem of coming to sitting through the back, meaning lying on the floor on their back, coming to sitting, getting into all fours. The crawl was usually probably compromised. So you're seeing these deviations, yes, in development, but also in the milestones. Does that make sense?
Tricky.
So again, it's just bringing back to where the brain doesn't know where here is, it's just where it is in space.
It's not magic. It's the system finally working the way it was designed. We don't train breath, we restore breathing function. We don't stop seizures, we stabilize them medically with medications, diets and/or other options.
Yeah, that's a big warning too. If you're looking for an environmental support system, a walker might be a more obvious one. But if you're looking for that a weighted blanket, swaddling, those kind of things, you're already saying that there's a problem, and that is right here. And that's why too, it's difficult too because lots of times in therapies you're being put into a position, right? And they're asking for you to do movement skills instead of you being able to accumulate your knowledge into your body and how it should be happening. It's a big difference.
If your child has a diagnosis, you haven't failed. You've just never been taught what movement really means.
Right. And you really have to watch that conversation of that because um when going to your doctor, you want development help, right? When you're going to the doctor, you might want milestone help. Your doctor's there for medical help. And so it's a different type of conversation, because so you're worried about crawling and they're worried that is your child got a cold or RSV. It's a different conversation.
Yeah.
Yeah. So let's look at what is autism. So first thing is you really have to know your child. The absolute first thing is you have to have a good visual examination. Guys, just because a child is here, they might have directionality, but that doesn't mean they're doing this and they're seeing, right? And so what you're trying to do is have these social skills emerge. A child with bad vision really doesn't know that this is a phone or this is a phone, right? And so you're looking for vocabulary to start to emerge. So pediatric ophthalmologist, and they have to perform a retinoscopy. A retinoscopy is a manual physical examination of the eyes. They can't use cards because also too a parent might say, "Oh, look at the circle," and they go, "Circle? Oh yeah, they saw the circle." No, that's echolalia. They didn't. That has nothing to do with it. But there are conditions of vision like cortical visual impairment, CVI, that can almost totally mimic autism. And so that's where some people are getting frustrated. I've been working with this autism for 2 years. Well, you have a vision issue, and they didn't catch it. And because a child too, any child, by the way, guys, if they see, that's the way they see. They don't go, "Mom, I wish I could still see the legs on that dog." Now, my eyes are starting to go. I'm a senior, so I know I can compare and say, oh, I'm not reading that as well. And I might put on my glasses. But a child only sees what they know how to see until you give
Mm.
them the comparison, which is the vision. And so it's really important.
I technically have two good pairs of glasses, but for several years we have been trying to figure out my complaint of not being able to see the frame on the right side. Mom sees better out of the non-insurance ones, so I'm patiently waiting to pick them up. Also, if we can secure my glasses on without falling, I want to start horseback riding with them. I just always figured it is just one more thing to worry about hitting off.
Well, you might want to look at contact lenses. That might be an option for the riding. I know a lot of people too are using, you can get these things that go over your ear pods, like app for Apple pods or whatever, that they, so you don't lose your pods, it's just a string. And a lot of people use that rubber, to secure the glasses in the back. And that's an option there to give you better.
Yeah. Mhm. Mm. Mm.
Contacts would not work. IMO move too much for makeup.
Yeah, contacts, it's a suction cup that your mother would put in your dad and put drop them in and then if they could come out of alignment, then they go in with that little suction cup and move it. So it's not typically like you and I would put in a contact. Someone would have to do it for you, but again, this is why it's a movement disorder. When we talk about all these things, some things work brilliantly for half the room and other times it just doesn't. And that is the probably the frustrations or complications of a movement disorder because it is great when someone says, try this, try this, try this, but you want to say, okay, I've already tried everything, but it's not working. And it is, that's just fine.
I crunch my face.
Oh yeah, I'm sure, and I can't put eye drops in my son, and he's 6'3". It's just
Mm.
like I said, it is what it is. Some things work for some people don't. Like a lot of people can't even put their own earrings in. They want to pass out. Um,
Uh,
you know, so but another thing to look at with autism is the fine motor skills. Now, this is more getting into your question of development. Can they actually come to midline? Now, coming to midline is coming to midline, but then they cross midline? Now, you and I can cross midline with like this. A child still needs to cross midline through the chest as well as the hand. And so you will see with autism when they turn, instead of turning inward to cross midline, they'll turn outward. Now, you might say, oh, Michelle, it was the same thing. No, they'll turn outward. They have to see with their chest. So the chest is never crossing midline instead of here where they're turning inward. Like if I need something, I might reach over like that and pick it up. Whereas you might see, oh, I've got it. I turn here and I'm like this. And it again, midline hasn't been crossed. That is a real early indicator that you can see in the munchkins, the babies. And so again, this is the stim or the wander because the hands they can't play. They can't just sit there and take something and play with it. They'll do right, right, left, left, but that crossing midline is a really uh something that needs to be worked on.
Same with spastic.
Yeah, yeah, no, no, no. This is why we're talking about movement disorders. The similarities are really not that far off. When the system breaks down, and this is why I'm talking about gravity and so forth. It's this is science to me. When the system breaks down,
Mhm.
it breaks down. It just a lot of people blame the CP on the damage to the brain, and they're looking for the damage of the brain for autism because that's what most sciences look at. If the brain's damaged, then the body's damaged. No, what I'm trying to say is when the science is damaged to the body, now it could be because of the brain, it could be to the genetics, it could be just because it's a movement disorder. But the science of movement breaks down significantly.
Mm.
So and then getting into the gross motor skills, which is again, you're crossing midlines, but in a bigger, kicking the ball, riding the bicycle. The rotational movement breaks down in simple tasks. Now, I might have rotation breakdown in hard tasks, like I'm golfing. Not every stroke, no, no, even though I'm a movement specialist, doesn't mean, I'm up there playing with Tiger Woods. I have to learn how to golf. So rotation will cap out on the upside as well, but to some people that's frustrating. For me, it's like, okay, I want to do better. But that's why some people can really throw a ball, but when it breaks down in simple skills, brushing your teeth, again, people say, oh, they have sensory issues. No, they can't do it. You know, just as a movement, right? It changes a lot.
Efficiency and effectively.
Yeah, it changes a lot of gross motor skills now into fine motor skills. And that's what
Mm.
you're seeing. Putting on a pair of pants for you is like almost like a fine motor skill versus,
Yeah.
somebody else. And that's the breakdown. So
Or speech.
exactly. So the tongue crossing midline, one of the biggest missed milestone is a raspberry. But if a child doesn't do a raspberry, they're not gonna swing on a swing. To me, that's like obvious, but teaching parents when they come to me, oh, my child didn't swing. Well, they didn't do a raspberry. And they're like, what? What does that have to do with swinging? But when we're looking at again, why people come to me success wise, that's why I feel I can get a lot more with movement lesson because I'm there to put, or my practitioners are there to put the function back in. And so a child that might be nonverbal will start talking, seeing better for sure. If you change the vision, you change every movement in the body. Their balance gets better, their peripheral. With autistic children, they have really no peripheral vision. So I have to teach them how to work the room again for those social skills, or even just sleeping through the night. That's what parents can expect really in short-term gains.
Or approximation.
Right. Again, if I'm trying to get someone to see better too, and they need glasses, this is where I need that conversation that goes, and I work very closely with a lot of medical doctors for that reason, because structure is still structure. You can have you can have issues because of visual complexity, right? You could have issues due to structure of the eye. And that could be eye alignment as well, but structure. But also you can have neurological processing issues. But to blame it on neurology when, you know what I mean? Like I need glasses. Well, that's not neural. Yes, yes, I don't process well because of neurology, but it doesn't make me any different.
No.
So, but yeah, it's not magic like you said before, but again, we have to start going or from stopping to fix a symptom and start activating function.
If your child has a diagnosis, you haven't failed. You've just never been taught what movement really means.
Oh, I know. The hardest is trying to teach a parent where they have to help their kid to see. My son went to Foundation for Blind, so I went through all of that, And we're not taught as parents that we'd have to teach our kids vision, much less, again, development and milestones. But in many way, they are trapped, especially with autism, and their body's ability to move. And we should move to transition our skills, and that's what's really important.
We want to hear from you. Send us your questions, your stories, your child's videos, because we're learning from every moment and building the world's first movement-based diagnostic system. Michelle has invented video AI, artificial intelligence, to evaluate your child's movements in the framework that will produce autism.
Yeah. As a parent, again, I wanted and needed a game plan. Nobody told me, my son got sick and lost everything. The goals originally were we're going to get him to walk and talk. And I'm like, okay, he already did it. It shouldn't be a problem. And then the goals changed without my knowledge and said, oh, he'll never be able to walk or talk.
Mm.
A goal at 4 was for him to say mom. Um, and then and thank goodness he can walk and talk because he's minoring in Russian and he's 6'3". But
Oh,
yeah, I have a moose and he's about to graduate. Oh, I'm gonna cry.
no.
Graduate college. And then, but I wanted a game plan. And they just said what he couldn't do. Graham really taught me how to see possibilities in everyone. That's the biggest one of the biggest gifts he gave me. But because again, we do it to each other. We see people's limitations, and we really don't encourage what's possible. And hopefully that comes out of the podcast. But when we're working with I just wanted a plan. And when they said he wasn't smart enough, and I was like, well, that's what do I do to make him smarter? What do I do? I knew every day he just had to get better. I just was on that. And I'm really excited. I've developed by doing these podcasts and webinars and all that I do. I have the largest library of working with the human body. Well, guess what? I can dump it into artificial intelligence. So with artificial, I know. I now have the parameters of showing, like I've taught my computer how to see like me or the AI. So it's actually doing analysis for kids or children's. My goal is literally that you'll be able to just give me a video and I put it or anywhere you can just go on the app and put in your video. And but I just have gotten secured funding for my infant motion sensor. And so all babies is my goal that they get checked at birth for movement. And then also too that parents would have a plan. This is where your child's at. This is what you should expect. Stick to it. Now, not everybody wants to follow the plan, but I'm here to give it.
And I would have had a diagnosis sooner.
Well, not only diagnosis sooner, it breaks
No.
my heart. It's all over the internet to this day. I'm not sure. My child's at high risk for CP. I've been in the hospital for like 8 weeks, and I'm like, oh, there's no not sure. What you're
Mm.
not hearing is that they're not at a position to diagnose yet. But as I tell people, you need to act if those words are coming out of your mouth, like cerebral palsy, let's say, you need to act now. You have to get involved. You have to age adjusting. One of the worst things we can do to a child and the family because they think somehow the child's going to catch up. Um, and you need to work on development, especially the more you need to adjust. It's not the better off you are, it's the worse off the child will be. And again, like me, I didn't know my son was sick, or I knew he was sick, but the doctors didn't know till he for 3 years. So if I had waited for them, I would have missed more than 3 years on just his, intervention work or whatever you want to call it at that stage. So
Let's shift the conversation from managing a diagnosis to understand how to unlock human potential.
yep.
And this is just the beginning. Coming up, a full mini-series on vision as a cognitive map, functional breath and regulation, rotational milestones, early detection through the infant motion sensor, and so much more. It's a wrap. Please, your suggestion and comments for this and future episodes helps us rock your world.
Yep. This episode is not just rock the world. It's to redefine it. Autism is a movement disorder, no matter even if it is genetics or due to movement trauma. We need to look at movement and think differently. And again, with abilities and with care, but at the same time too, that it's pretty cool to be different. And you just are going to come up with new things to do it.